Colon cancer is a disease that affects the large intestine, which is also known as the colon. It is the third most common type of cancer in men and women worldwide. It can be found in the rectum and the lower part of the colon. The disease is also known as colorectal cancer because it mostly affects this region of the body. To reduce your risk of developing colon cancer, you should follow these guidelines. Eat more vegetables and fruits. A large number of people in the United States are at an increased risk of developing colon cancer. The risk is higher for those who are overweight or obese, have a family history of colon cancer, and do not eat enough vegetables and fruits. The risk of developing colon cancer is reduced by eating more vegetables and fruit. This includes things like broccoli, carrots, apples, blueberries, oranges, and tomatoes. There are a lot of ways that you can incorporate more vegetables into your diet without having to change the way you cook or eat them. You can make vegetable dishes with meat or fish, or even just eat them raw with dips or salads. Eat enough fiber-rich foods like vegetables and whole grains. We should eat enough fiber-rich foods like vegetables and whole grains to reduce our risk of colon cancer. Fiber helps us maintain a healthy digestive system and prevents constipation, which can increase your risk for developing colon cancer. A study published in JAMA Surgery suggests that people with high fiber intake have a lower risk for colon cancer than those with low fiber intake. Drink more water. To stay healthy, it's important to drink enough water. The National Cancer Institute recommends drinking at least 8 glasses of water per day to help reduce the risk of colon cancer. Smoking cigarettes or being exposed to secondhand smoke. There are many ways in which you can reduce your risk of developing colon cancer. One way is to stop smoking cigarettes and other harmful habits. Smoking cigarettes is the most common cause of colon cancer, and it can be prevented simply by quitting smoking. Smoking increases the risk of developing a number of different cancers, including lung, throat, esophagus, liver, stomach, and bladder cancers. A study has shown that smokers have a higher risk of developing colon cancer than non-smokers do. The study found that the risks were increased by 10 to 30%. Drinking alcohol excessively. Drinking alcohol excessively can lead to colon cancer. It is a disease that is becoming increasingly common in the United States. A study conducted by the National Cancer Institute found that people who drink more than 2 alcoholic drinks a day have an 80% chance of developing colon cancer during their lifetime. Drinking alcohol excessively can lead to several health problems, including liver cirrhosis and pancreatitis. Limit your intake of red meat. Colon cancer is the third most common cancer in the United States, with about 50,000 new cases diagnosed every year. The good news is that it can be prevented by limiting your intake of red meat. Red meat is a known risk factor for colon cancer, and it's recommended to limit your intake of red meat to less than 18 ounces per week. This is equivalent to about 3 to 4 servings per week. The reason for this recommendation is that studies have shown that people who eat red meat are at a higher risk for developing colon cancer than those who don't eat red meat. Avoid processed meats like bacon, hot dogs, and deli meats. Processed meats like bacon and hot dogs have been linked to a higher risk of developing colon cancer. The American Institute for Cancer Research recommends avoiding processed meat products like bacon, hot dogs, and deli meats because they can cause DNA damage that leads to colon cancer. Avoid soft drinks and sugar-sweetened drinks. The risk of developing colon cancer is associated with the consumption of sugar-sweetened beverages. The American Institute for Cancer Research has listed sugar-sweetened drinks as a group that should be avoided. It is also important to maintain a healthy weight and exercise regularly to lower your risk of developing colon cancer.